Hello, I'm very happy to give this talk on comorbidities related with obesity, with a special focus on non-alcoholic fatty liver disease. So the prevalence of obesity is high globally. We can see here the prevalence in many countries, which varies between 10% to up to almost 30% in certain countries. And when we look at the trajectories of obesity from 1990 to 2015, we can see that in most countries, regardless of the social demographic index of these countries, there is increased prevalence of obesity in both children and adults. And obesity leads to increased mortality and also increased disability-adjusted life years, DALYs. So if we compare the 1990s DALYs and mortality to 2015, we can see a major increase in the number of DALYs and deaths. And when we look at the BMI, we can see that the numbers are increased, especially among people with a BMI of above 30. And there is a very strong correlation, of course, between the prevalence of non-alcoholic fatty liver disease and the prevalence of obesity, as demonstrated in varying countries. And so I'll devote the next slides of my talk to the association between obesity and NAFLD and nutritional intake and NAFLD. So the global prevalence of non-alcoholic fatty liver disease is quite impressive, and it is about 24% in Europe, 24% at least in North America. In the Middle East, it's 32%. This is a study conducted by my group. And even in Africa, where you would expect lower prevalence rates, you can still find 13.5 prevalence of NAFLD. And importantly, a substantial proportion of people are not only suffering from obesity, but also drink too much alcohol. And the combination of obesity and increased alcohol intake leads to increased liver damage. This can be demonstrated in this study, which indicates a strong synergism between alcohol and obesity in causing severe liver disease. In this cohort study, we can see that both men and women who have a high waist-to-hip ratio indicating obesity have much greater risk of severe liver disease if they consume alcohol, not only alcohol abuse, but also consumption of alcohol within the normal accepted range of up to 10 or 20 grams of alcohol per day are related with increased risk of severe liver disease if you suffer from obesity. Now, fatty liver disease is in fact the hepatic manifestation of the metabolic syndrome, and it has been demonstrated in many studies to be related with insulin resistance, which is a key factor in its pathogenesis, with hypertension and cardiovascular disease, dyslipidemia, and of course, type 2 diabetes. And when we look at the prevalence of NAFLD in patients with type 2 diabetes, we see very high prevalence, reaching almost 60%. Moreover, when we look at NAFLD as a risk factor for incident type 2 diabetes, we can see that that NAFLD increases the risk of type 2 diabetes by twofold, independent of other risk factors. Interestingly, there is also inverse association between NAFLD and remission of type 2 diabetes. If a patient has NAFLD, he has 50% less chance to have remission of type 2 diabetes in 2 years follow-up. However, if patients with NAFLD change their lifestyle and treat NAFLD and have remission of NAFLD, they have threefold greater chance of remission also of type 2 diabetes. Moving to cardiovascular disease, NAFLD increases the risk of cardiovascular disease by 60%. In a study we conducted recently, we have shown that fibrosis marker, FIB4, is also a strong predictor of cardiovascular morbidity and mortality. In both men and women, FIB4, which in the above the level of 2.67, which indicates F3, F4 fibrosis, has increased the risk of cardiovascular morbidity and mortality by 60%. This was adjusted for many important risk factors for cardiovascular disease. Interestingly, significant fibrosis also predicts new onset of type 2 diabetes and hypertension. And more importantly, even among patients without obesity with BMI below 30, the presence of significant fibrosis increases the risk of type 2 diabetes by threefold, and the risk for hypertension by 2.5-fold. Importantly, when we treat these patients with Mediterranean diet to prevent cardiovascular disease, the beneficial effect of Mediterranean diet is in fact mediated by improvement in the amount of liver fat. So treatment of Mediterranean diet improves liver fat, and this is one of the important causes for the reduction in the risk for cardiovascular disease. So we know that there are certain factors that increase disease progression of NAFLD, including type 2 diabetes, obesity, genetic predisposition, age, alcohol consumption, and unhealthy lifestyle. In contrast, weight loss, coffee, exercise, Mediterranean diet, and vegetable intake reduces this disease progression, and I will discuss it in the next slides. So weight reduction is very well established in the treatment of NAFLD, consistently reducing steatosis, ALT, NAFLD activity score, and also fibrosis, although with less consistent results. Which diet should we take? So the Mediterranean diet is the most recommended diet for NAFLD. And looking at this randomized clinical trial, which lasted for 18 months, we can see that the combination of Mediterranean low-carb diet with physical activity led to the greatest reduction in the amount of liver fat as compared to only low-fat diet without physical activity. And this happened despite the fact that all groups had similar weight reduction. Now let's talk about the quality of the food. So ultra-processed food is very common in the Western world, at least, and it actually encompasses 50 to 60% of the daily calories eaten, and it is a major source of sugar and saturated fat. Ultra-processed food has been demonstrated in several prospective studies to be related with increased mortality, cancer incidence, cardiovascular disease, and type 2 diabetes incidence. And it is very much composed of sugary products. About half of it is composed of sugary products and soft drinks. If people are provided for a couple of weeks with ultra-processed food versus minimally or unprocessed food, they eat more and they gain weight, as demonstrated in this crossover randomized clinical trial. So that means if we want our patients to lose weight, we need to recommend them to reduce as much as possible the consumption of ultra-processed food, which is designed to be hyperpalatable and designed to encourage us to eat more and more of it. Moving specifically to processed meat, we have shown previously that high consumption of red and processed meat is related with NAFLD and insulin resistance. And if you fry it or prepare it to a very well done level, it is also related with insulin resistance, something that is explained by the formation of unhealthy compounds during this preparation method, which are heterocyclic amines and advanced glycation end products, which are related with insulin resistance and inflammation. This is supported also by a study from the United States showing that high consumption of red and processed meat is related with NAFLD with and without cirrhosis. High cholesterol intake is related with NAFLD with cirrhosis, while fiber intake is a protective factor. Saturated fat has been demonstrated in many studies to be related with increased amount of liver fat in many randomized clinical trials, as demonstrated also in this study. Within 3 weeks, high consumption of saturated fat increased the amount of liver fat, something that did not occur with high consumption of unsaturated fat. Sugar is an extremely important risk factor for NAFLD. And in this study, this is amazing because infants consuming soft drinks at the age of 1 year have threefold increased risk of having NAFLD at the age of 10 years. And this soft drink consumption also includes fruit juice. Moving to polyphenols, we know that the high consumption of fruits and vegetables and nuts and coffee and tea is healthy for the liver. One of the reasons is its high content of phenolic acids, which is a subgroup of polyphenols, which are very strong antioxidants. And we have demonstrated in one of our studies that high consumption of phenolic acids is protective from NAFLD, fibrosis as indicated by fibrosis markers, and insulin resistance. Going back to Mediterranean diet, which is enriched with polyphenols called green Mediterranean diet, is more effective in the reduction in the amount of liver fat as compared to regular Mediterranean diet, despite the fact that weight loss in 18 months treatment was similar in both arms. So Mediterranean diet plus polyphenols is more helpful. More importantly, they looked at the factors that are associated with the improvement in liver fat, and they have shown that less red meat, less processed meat, and higher consumption of walnuts, which are rich in omega-3 fatty acids, and higher consumption of polyphenols is related with the best beneficial effect on the reduction of the amount of liver fat. And interestingly, some of this beneficial effect was mediated by the change in microbiome composition following the Mediterranean diet. So this is how our plate should look like. This is the Eat Lancet project. And they did some predictions showing that if we have a lot of vegetables, minimal amount of red and processed meat, more plant source protein, no sugar, we would save 11 million adult lives per year. So it's worth a try. And everything that I said that is good for NAFLD is also good for the prevention of hepatocellular carcinoma. So this slide actually summarizes everything, and we can see that red and processed meat consumption increase the risk of HCC. Fish and omega-3 fatty acids reduce the risk of HCC. High cholesterol intake increase the risk of HCC. Vegetable reduce the risk. High-fat dairy products, which are rich in saturated fat, increase the risk of HCC, as well as high butter consumption. And coffee, any kind of coffee, reduces the risk of HCC. And altogether, having a healthy dietary pattern, which is very similar to the Mediterranean dietary pattern, as you can see here on the left, also is related with reduced risk of HCC. And finally, I would like to summarize everything I said in this slide. So, obese NAFLD patients should have 7 to 10% weight reduction, which has been demonstrated to reduce the risk of disease progression and improve all aspects of NAFLD, steatosis, NASH, and fibrosis in a dose-response manner. But even normal weight NAFLD patients can benefit from weight reduction. It has been shown in a few studies that if they reduce their weight very moderately, by about 5% from their initial body weight, they do get significant reduction in steatosis. All patients should do physical activity, which is of course also beneficial. And all patients should change their dietary composition towards the Mediterranean diet, as you can see on the left, and reduce ultra-processed food consumption, fructose consumption, sugar consumption as much as possible. Alcohol should be abstained as much as possible since it is related with disease progression, even a very modest amount of consumption. Smoking increases the risk of fibrosis progression, and if patients can go to smoking cessation programs, it would be very beneficial for them. Thank you very much for listening.